Managing diabetes isn't just about monitoring your blood sugar levels. It's about making smart, healthy choices that support your body's natural functions. One of the most important factors in managing diabetes effectively is understanding the crucial role that vitamins and minerals play. These nutrients don't just support general health, they can help regulate blood sugar, boost insulin sensitivity, and prevent long-term complications that are often associated with diabetes. In today's video, we're diving deep into the top 10 vitamins and minerals that are absolutely essential for anyone living with diabetes. If you're someone who is managing diabetes or simply looking to improve your overall health, these nutrients could make all the difference. Let's explore each one, and by the end, you'll have a better understanding of how to incorporate these vitamins and minerals into your daily routine. Vitamin A, the hidden defender. When we think of vitamin A, we often picture better vision and eye health. But for people with diabetes, this powerhouse nutrient does so much more. Vitamin A is a fat-soluble vitamin, meaning it's stored in your fat cells and used by your body when needed. It's found in foods that are rich in vibrant colors, such as carrots, sweet potatoes, and leafy greens like spinach and kale. But why is vitamin A so important for diabetics? Diabetes leads to higher blood sugar levels, and over time, these elevated levels can cause oxidative stress, which damages cells and accelerates the development of complications. Free radicals, unstable molecules produced by high blood sugar, can harm your body's cells, especially in tissues like the blood vessels, eyes, and nerves. That's where vitamin A comes to the rescue. With its strong antioxidant properties, vitamin A helps neutralize these free radicals, protecting the cells from the damage that oxidative stress can cause. But it doesn't stop there. Vitamin A also plays a key role in improving insulin sensitivity. Insulin is the hormone that regulates your blood sugar levels, and in people with diabetes, insulin often doesn't work as efficiently. By maintaining adequate levels of vitamin A, you can help ensure that your body uses insulin more effectively, keeping your blood sugar levels in check. But vitamin A's benefits extend beyond just managing blood sugar levels. For diabetics, the immune system can become weakened, leaving the body vulnerable to infections. Vitamin A plays an essential role in fortifying the immune system by supporting the function of white blood cells, which help protect the body against pathogens. It also strengthens mucosal barriers, the protective lining in areas such as the nose, mouth, and digestive tract, acting as a first line of defense against infections. Incorporating vitamin A into your diet isn't as difficult as it may seem. It's found in a wide variety of delicious and nutrient-dense foods. Carrots and sweet potatoes are an excellent source of beta-carotene, the precursor to vitamin A. Dark leafy greens like spinach and kale are full of nutrients while being low in calories. And don't forget eggs, dairy, and oily fish like salmon, which provide retinol, the active form of vitamin A. By making these foods a regular part of your diet, you'll be giving your body the support it needs to manage blood sugar and protect against infections. Vitamin A truly is a hidden defender for anyone managing diabetes. Vitamin B complex, vital for nerve and energy health. Vitamin B is a group of nutrients that play a vital role in the health of your body's energy systems and nerve function. For people with diabetes, maintaining healthy levels of B vitamins is essential for managing both energy levels and nerve health, two key concerns in diabetes management. Let's dive into some of the most important B vitamins that diabetics should focus on. Vitamin B1, thiamine. Vitamin B1, or thiamine, is incredibly important for those living with diabetes. Thiamine helps convert the food we eat into energy, a process called metabolism. But its role doesn't stop there. High blood sugar levels in people with diabetes can lead to the accumulation of harmful byproducts, which can cause damage to cells and tissues. Thiamine helps prevent the buildup of these harmful substances, protecting the body from complications like nerve damage and cardiovascular issues. Thiamine has also been shown to improve kidney health. Diabetic nephropathy, a condition that affects the kidneys, is a common complication in those with diabetes, and ensuring you get enough thiamine can help lower the risk of kidney damage. Vitamin B12. Vitamin B12 is essential for maintaining healthy nerve cells and the production of red blood cells. For diabetics, particularly those on metformin, a common medication for diabetes, there's a higher risk of developing a vitamin B12 deficiency. A deficiency in B12 can lead to serious complications such as neuropathy, nerve damage, and anemia. Neuropathy, a TTE condition that results in pain, numbness, and weakness in the hands and feet, is one of the most common complications associated with diabetes. By ensuring you get enough vitamin B12, you can help prevent or alleviate the nerve damage caused by diabetes. Regularly checking B12 levels, especially for those on metformin, is highly recommended to avoid potential deficiencies and related complications. Vitamin B6 and B12, neurotropic support. Vitamins B6 and B12 are often referred to as neurotropic B vitamins because they are critical for nerve health. These vitamins support the function of neurotransmitters, chemicals that carry signals between your brain and the rest of your body. Adequate levels of these vitamins help keep your nervous system functioning properly, which is especially important for preventing or managing neuropathic pain and other neurodegenerative symptoms often seen in diabetes. A balanced diet that includes whole grains, lean meats, eggs, and dairy products can provide most of the B vitamins you need. If you follow a vegetarian or restricted diet, you may need to consider fortified foods or supplements, particularly for vitamin B12, which is primarily found in animal products. Consult with your healthcare provider to ensure you're getting enough of these essential nutrients. Conclusion: the power of vitamins for diabetes management. Incorporating these vitamins into your daily routine can significantly improve your ability to manage diabetes and protect against its complications. Vitamin A's antioxidants work to protect your cells from damage, while the B vitamins support energy production and nerve health. Together, these nutrients form a strong foundation for diabetes management, giving you the tools you need to live a healthier and more balanced life. So, make sure you're getting enough of these essential vitamins through a healthy, nutrient-rich diet. These small changes can make a world of difference in your diabetes journey. Magnesium is an essential mineral that plays a key role in supporting a healthy metabolic system. In particular, it works closely with insulin, the hormone that helps regulate blood sugar levels. People living with diabetes often struggle with insulin resistance, which means their bodies don't respond to insulin as effectively as they should. This makes blood sugar control more difficult. Fortunately, magnesium can be a powerful ally in diabetes management. When magnesium levels are sufficient, insulin works more efficiently to transport glucose into cells, where it's used for energy. This helps lower blood sugar levels and ensures that glucose doesn't accumulate in the bloodstream. But magnesium does much more than just support insulin function. It also has anti-inflammatory properties that can help reduce oxidative stress, which is common in people with diabetes. Oxidative stress can lead to cellular damage and worsen diabetes-related complications. By lowering inflammation, magnesium helps to protect the body from these harmful effects. Magnesium has also been shown to improve cardiovascular health, which is incredibly important for people with diabetes. High blood sugar levels over time can cause damage to blood vessels, leading to conditions like high blood pressure, heart disease, and kidney issues. Magnesium works to regulate blood pressure by relaxing the blood vessels, improving circulation, and helping to maintain a healthy heart and kidneys. It can even reduce the risk of kidney disease by lowering excessive blood sugar and reducing oxidative damage to the kidney cells. For those living with diabetes, sleep disturbances and high stress levels are common problems. Magnesium can help here too. It promotes the production of GABA, a neurotransmitter that helps relax the nervous system and prepare the body for deep, restful sleep. It can also reduce cortisol levels, the hormone associated with stress, which in turn helps to improve blood sugar control. Better sleep and lower stress can have a profound impact on overall metabolic health, leading to improved diabetes management and well-being. While magnesium supplementation is a potential option for those struggling to meet their daily magnesium needs, the best way to maintain healthy magnesium levels is through diet. People with diabetes can benefit from incorporating magnesium-rich foods into their meals. These include nuts and seeds, such as almonds, cashews, and chia seeds, leafy greens like spinach, kale, and collard greens, legumes such as black beans, lentils, and edamame, and whole grains like quinoa, brown rice, and oatmeal. Fatty fish like salmon and mackerel are also excellent sources of magnesium, as are fruits like bananas and avocados. Even dairy products like low-fat yogurt and milk can provide some magnesium. If you find it challenging to get enough magnesium through food alone, magnesium supplements could be helpful. There are several types of magnesium supplements available, with Magnesium,
glycinate, citrate, and chloride being some of the most easily absorbed forms. However, it's important to consult with a healthcare provider before starting any new supplement, as taking too much magnesium can cause digestive discomfort, low blood pressure, and even interactions with certain medications. Potassium is another mineral that plays an indispensable role in diabetes management. It helps regulate fluid balance in the body, aids in nerve signaling, and is crucial for muscle contractions. But perhaps one of its most critical roles is in supporting the pancreas's ability to produce and release insulin. Insulin helps move glucose from the bloodstream into cells for energy, and without adequate potassium, this process can be impaired. When potassium levels drop too low, the pancreas produces less insulin, which can lead to higher blood sugar levels. This not only makes diabetes harder to control, but also increases the risk of complications. People with low potassium levels often experience higher insulin resistance, a condition where the body's cells no longer respond to insulin effectively, forcing the pancreas to work harder to regulate blood sugar levels. Over time, insulin resistance can lead to the development of type 2 diabetes. Without enough potassium, glucose stays in the bloodstream rather than entering the cells, causing prolonged high blood sugar levels. For those managing type 1 diabetes, potassium levels are even more critical. A condition called diabetic ketoacidosis, DKA, can occur when there is a severe lack of insulin in the body. DKA often causes potassium levels to drop even lower, which requires careful monitoring and supplementation. In these cases, potassium supplementation is crucial for maintaining balance and preventing further complications. Additionally, potassium is vital for heart and kidney health. People with diabetes are at a higher risk of developing cardiovascular diseases, including high blood pressure and heart disease. Potassium helps relax blood vessel walls, reducing blood pressure and lowering the risk of heart attacks and strokes. It also plays an essential role in protecting the kidneys. People with diabetes may experience kidney damage, which can lead to an imbalance in potassium levels. Maintaining healthy potassium levels through diet can help slow the progression of kidney disease in people with diabetes. The best way to ensure adequate potassium intake is through food. Potassium-rich foods include fruits like bananas, oranges, kiwis, and apricots, vegetables such as spinach, sweet potatoes, and mushrooms, legumes like lentils, beans, and chickpeas, and dairy products like yogurt and milk. Fish, especially fatty types like salmon and tuna, are also great sources of potassium. Vitamin C is another nutrient that plays an essential role in diabetes management. People with diabetes are often at a higher risk of developing complications due to elevated oxidative stress, which occurs when there are too many harmful free radicals in the body. This oxidative stress can damage tissues and organs, contributing to complications like nerve damage, heart disease, and kidney issues. Vitamin C, a powerful antioxidant, helps to neutralize these free radicals and protect the body from damage. In addition to its antioxidant properties, vitamin C also has anti-inflammatory effects. Chronic inflammation is a common issue for people with diabetes and can worsen symptoms and lead to complications. By reducing inflammation, vitamin C helps manage blood sugar levels and may reduce the risk of developing long-term complications associated with diabetes. One of the most significant benefits of vitamin C for people with diabetes is its ability to help regulate blood sugar levels. Studies have shown that vitamin C can lower fasting blood glucose levels and improve glycated hemoglobin, HbA1c, a marker used to track long-term blood sugar control. This makes vitamin C an important ally in the long-term management of diabetes. Vitamin C can also help enhance insulin sensitivity, allowing the body to use insulin more effectively. The best sources of vitamin C are fresh fruits and vegetables.
Citrus fruits like oranges, grapefruits, and lemons are well-known sources of vitamin C, as are vegetables like bell peppers, broccoli, and spinach. Incorporating these foods into your daily meals can help ensure you get enough vitamin C, which can provide a range of benefits for diabetes management. If you're not able to get enough vitamin C from food alone, supplements may be a good option. However, it's always best to consult with a healthcare provider before starting a supplement regimen to ensure that it's safe and effective for you. Moving on to potassium, an essential mineral that plays a crucial role in regulating fluid balance, nerve signals, and muscle function. Potassium works alongside other electrolytes like sodium, calcium, and magnesium to help the body function properly. One of its key roles in diabetes is in maintaining glucose homeostasis. The pancreas relies on potassium to produce and release insulin, the hormone that helps move sugar from the bloodstream into cells. If potassium levels drop too low, a condition known as hypokalemia, insulin secretion can decrease, leading to higher blood sugar levels and an increased risk of complications related to diabetes. Potassium is also vital for managing insulin resistance, a condition where the body's cells don't respond well to insulin, forcing the pancreas to produce more insulin to keep blood sugar levels in check. Over time, this can lead to type 2 diabetes. Inadequate potassium means glucose stays in the bloodstream instead of entering cells, which causes prolonged high blood sugar levels and increases the risk of developing complications like nerve damage, kidney disease, and cardiovascular problems. For people with type 1 diabetes, potassium becomes even more critical. Diabetic ketoacidosis, DKA, is a severe condition caused by a lack of insulin, which often leads to low potassium levels. When insulin therapy is administered to reverse DKA, potassium levels can drop even further, so careful monitoring and supplementation are essential. People with diabetes are at significantly higher risk of developing heart disease and kidney disease, both of which can benefit from adequate potassium intake. Potassium helps relax blood vessel walls, reducing blood pressure and lowering the risk of cardiovascular complications. It also supports kidney function, which is crucial for filtering potassium from the bloodstream and preventing imbalances. If kidney function is compromised due to diabetes-related kidney damage, known as diabetic nephropathy, potassium levels can become unstable. A diet rich in potassium may help slow the progression of kidney disease. To maintain healthy potassium levels, focus on natural sources like fruits such as bananas, oranges, and kiwis, vegetables like spinach, leafy greens, mushrooms, and sweet potatoes, legumes including lentils, beans, and chickpeas, dairy products such as yogurt and milk, fish like salmon and tuna. The recommended daily intake is 2,600 milligrams for women and 3,400 milligrams for men. However, this should be adjusted based on individual health conditions particularly for those with kidney issues, as excessive potassium intake can lead to hyperkalemia, a potentially dangerous condition. Vitamin C is another powerhouse nutrient for people with diabetes. Diabetes often leads to elevated levels of oxidative stress due to prolonged high blood sugar, which can damage cells and tissues throughout the body. Vitamin C, with its strong antioxidant properties, helps neutralize harmful free radicals, thereby protecting tissues from damage. It also helps reduce systemic inflammation, which is common in diabetes and can lead to complications like cardiovascular disease. Vitamin C has been shown to lower fasting blood glucose levels and reduce HbA1c, glycated hemoglobin, an important marker for long-term blood sugar control. This makes vitamin C a valuable ally in diabetes management. Additionally, vitamin C enhances insulin sensitivity, meaning the body can use available insulin more effectively to reduce blood glucose levels. In terms of cardiovascular health, vitamin C strengthens the vascular walls and improves endothelial function, which helps protect the blood vessels from damage caused by high glucose levels. Vitamin C's ability to lower blood pressure also contributes to overall heart health. To boost your vitamin C intake, consider incorporating more of these foods into your meals. Citrus fruits like oranges, lemons, and grapefruits. Vegetables like bell peppers, broccoli, and spinach. Incorporating these into your daily diet can provide a wealth of other essential nutrients as well, helping support overall diabetes management. Though vitamin C supplements can be beneficial for those who may not get enough from food, it's always best to consult with a healthcare provider before adding any new supplements to your routine.